All he knew was that he had bad blood. This is what they told Charlie Pollard. For 40 years, that is all they ever told him. Not that he had syphilis. Not that there was a cure available. Not that the United States government was watching him die. Just that he had bad blood. And that the government doctors were taking care of him. This is the story of the Tuskegee Syphilis Study. One of the most disturbing things the American government has ever done to its own citizens. And unlike most dark chapters of history, this one did not happen in the distant past. It ended in 1972. There are people alive today whose parents lived through it. Chapter 1. The Setup. The year is 1932. The Great Depression has devastated the United States. Macon County in Alabama is one of the poorest counties in the entire country. Almost the entire population is made up of black sharecroppers working land they will never own, with no education, no health care, and no legal protection. Syphilis is spreading through the rural South at epidemic levels, and the United States Public Health Service sees what they call an opportunity. Dr. Talia Farrow Clark, who runs the government's Division of Venereal Diseases, writes in 1932 that Alabama offers, in his own words, an unparalleled opportunity for the study of the effect of untreated syphilis. Not a crisis to be solved. Not a population in need of care. An opportunity to study what happens when sick, poor black men receive no treatment and simply deteriorate. 600 black men were recruited. 399 of them had syphilis. None of them were told what they actually had. Instead, they were told they had bad blood, and they were promised free medical examinations, free meals on clinic days, and a $50 burial insurance policy. Think about that last one. They were offered burial insurance, not a cure. A guaranteed burial. That was the deal. And because these men had nothing, that offer was enough. Chapter 2. How the lie worked. In 1933, the researchers wanted to perform spinal taps on the participants, a painful and invasive procedure involving a needle inserted into the spinal column, with no anesthetic. The men had no reason to agree to this, so the government sent them a letter. The letter read, in capital letters, "You have gotten a great deal of treatment for bad blood. Remember, this is your last chance for special free treatment. Be sure to meet the nurse." Special free treatment. That is what they called it. The men showed up. Because they trusted the government doctors. Because they believed they were being helped. They were not. To make sure no one accidentally treated these men, the Public Health Service also contacted every local doctor in Macon County and instructed them, if any study participant comes in sick, do not treat them. Report back to us. The local doctors complied. There was one more layer to this system. Her name was Eunice Rivers, a black nurse hired by the government to be the human face of the study. For 39 years, Eunice Rivers drove the men to their appointments, collected their data, notified their families. The men loved her and followed her without question. She was also the one who, when a local doctor tried to treat some participants, told him, "He is under study and not to be treated." That doctor later said those words left him, and I am using his exact words, distraught and disturbed. Chapter 3. 1943. The cure exists. This is the moment everything changes. In 1943, penicillin is confirmed as a safe and effective cure for syphilis. By 1947, it is widely available and works even in advanced stages of the disease. There is now a cure. The government knows. The researchers know. They decide not to give it to the men in the study. This was not an accident. This was a deliberate, official policy, discussed and approved at the highest levels of the United States Public Health Service. The stated reason: if the men receive treatment, the researchers can no longer observe the natural progression of untreated syphilis. The integrity of the data mattered more than the lives of the men. And then consider this. During World War II, several participants received draft notices and would have been examined and treated by the military. The Public Health Service intervened. They contacted draft boards and had the study participants exempted from military service. Not to protect them. To protect the data. Men who were already being denied a cure were also denied the chance to serve their country, because the government was afraid the army would accidentally heal them. By 1969, internal estimates acknowledged that between 28 and 100 men had already died. The government convened an oversight committee. The committee voted to continue. No objection. Chapter 4. The One Man Who Said No. His name was Peter Buxton. He was 28 years old, a public health service employee in San Francisco, when he heard colleagues mention a study in Alabama. He asked to learn more. What he found shocked him. He later said, "I did not want to believe it. This was the Public Health Service. We did not do things like that." But they had, for 33 years already. In 1966, Buxton filed a formal protest citing ethical violations. It was rejected. The reason given: the study was not yet complete. The study was designed to end only when all participants had died and their autopsies were completed. So not yet complete meant they have not all died yet. One of his superiors said to him, "I will send your report up the line, but remember I have a wife and kids. Please forget my name when they ask you why you did this." Buxton filed a second protest in 1968, explicitly comparing Tuskegee to the Nazi experiments tried at Nuremberg. A committee was convened. The committee recommended continuing the study until all participants were dead. Buxton left the Public Health Service, but he did not forget. In 1972, he gave the documents to journalist Jean Heller at the Associated Press. On July 25, 1972, the story ran on the front pages of newspapers across the United States. The study was stopped immediately. Chapter 5. The Toll. When the study ended, this was the count. 28 men dead directly from syphilis. Approximately 100 more dead from complications. 40 wives infected by husbands who did not know they were contagious. 19 children born with congenital syphilis, inheriting a disease the government had refused to treat in their fathers. Of the 399 men originally enrolled, only 8 were still alive when President Clinton issued a formal apology in 1997. The last surviving participant died in January 2004. And here is what untreated syphilis actually does to a body. In the early stages, ulcers appear and then seem to heal. Then rashes spread across the entire body, including the palms and the soles of the feet. Then comes the latent phase, where symptoms disappear but the disease is still active. Many of the men spent years in this phase believing they were getting better. And then, 10 to 30 years later, tertiary syphilis arrives. It attacks the aorta, causing lethal aneurysms. It attacks the brain, causing dementia, blindness, and paralysis. These men experienced all of this, without ever being told the truth, monitored until the end by doctors they believed were helping them. Chapter 6. The Reckoning. After the story broke, civil rights attorney Fred Gray filed a class action lawsuit. Fred Gray was the same lawyer who had defended both Rosa Parks and Martin Luther King Jr. The case settled in 1974 for $10 million. Not a single person was ever criminally charged. Not one doctor. Not one official who voted in 1969 to continue while men were dying. Not one criminal conviction. On May 16, 1997, President Bill Clinton invited the surviving participants to the White House. 5 of the 8 still living made the trip. Clinton said, "What was done cannot be undone. But we can end the silence. We can look at you in the eye and finally say on behalf of the American people, what the United States government did was shameful, and I am sorry. To our African American citizens, I am sorry that your federal government orchestrated a study so clearly racist." One of the survivors, Herman Shaw, was 94 years old that day. He had been living with syphilis since 1932. 65 years. Chapter 7. The Wound That Never Closed. The Tuskegee study did not only kill the men directly involved. Research published in 2018 found that after the story broke in 1972, there was a measurable drop in the rate at which black men in the United States interacted with the healthcare system. They went to the doctor less. They sought treatment less. This distrust contributed to a real gap in life expectancy in the following decades. A 40-year government lie killed people who had never heard of Tuskegee and were not yet born when it happened. When COVID-19 vaccines became available in 2020 and 2021, vaccination rates in Black American communities were initially significantly lower than in other groups. Surveys consistently identified Tuskegee as a reason people hesitated. And Tuskegee was not isolated. The same agency, the United States Public Health Service, ran experiments in Guatemala between 1945 and 1956, deliberately infecting prisoners and psychiatric patients with syphilis. This was not discovered until 2010. Those Guatemala experiments ran while the Nuremberg trials were establishing international law against exactly this kind of research. In Nuremberg, the world was judging Nazi doctors for experimenting on human beings without consent. In Alabama, it was already happening. There are questions that have never been answered. How many people actually died? The official numbers are estimates. How many were never counted? Why was no one ever criminally prosecuted? Not one person. After 40 years. And what else exists in archives we have not yet opened? If you think this story needs to be heard, subscribe, and tell us in the comments what other hidden chapters of history you want us to cover next. Because there are more stories like this one, and they deserve to be told.